Good evening. I'm Selwyn Collins, your host of CWS Conversations with Selwyn. Thank you for tuning in. And those of you who are tuning in for the first time, thank you very much. I just want to take a moment to acknowledge or pay respect to a recent loss to humanity in Dr. Maya Angelou. Quite recently, the world mourned this amazing person, the loss of this amazing person. Dr. Maya Angelou was a beautiful spirit, a poet, a dancer, a creative, among all things. But what struck me most about her is how obedient she was to her soul, how obedient she was to her purpose. And because of that obedience, we are beneficiary of a work, a body of work. I hasten to say that I don't think there's anyone who has ever read any of her work has remained untransformed in some way. And even though I'm very saddened by this loss, I am even more comforted knowing that her work, her spirit lives on in each of us. Because you see, to me, Dr. Maya Angelou transcended geography and ethnicity. She was a woman for all the people. She spoke from her heart. She spoke with passion. She spoke with authenticity. And so I want to leave you with this. Whenever you have an idea, commit to it, be passionate, and see it through. I am back, and the lovely lady next to me is Dr. Nicole Singh. Nicole, good evening,
Good evening, Selwyn.
and welcome to CWS.
Thank you.
I can only hear you. I don't know if it's your volume low or something, but anyway, let's leave it at that for the time being. Dr. Singh is MD internist, board certified in internal medicine, University of Pennsylvania, Bachelor of Arts. University of Pennsylvania, where she received the Bachelor of Arts, received full academic scholarship to Albany Medical College, Beth Israel Deaconess Medical Center, Harvard Medical School, teaching teaching hospital. She did her residency. Internal medicine practice in the Washington, D.C. area for 14 years. Hospital affiliations are Georgetown University Hospital and George Washington University Hospital. Previously named as top doctor in Washingtonian Magazine and Virginia Living. Well, congratulations on all your accomplishments, Dr. Singh. It is a pleasure to have you on CWS. If you weren't a physician, what would you be doing?
Hmm. First, can you hear me better now, Selwyn?
I can hear you better, yes.
Okay. Well, my passion other than medicine has always been music. And when I was in either elementary school or middle school, I can't remember exactly, I discovered the flute. Neither I found the flute or the flute, either I chose the flute or the flute chose me. I'm not sure which, but I was blessed to be able to play in a way that I really enjoyed it, and I saw the joy and the enjoyment that it gave, that my playing gave others, and I probably would have gone into music if it wasn't for my other passion, which is medicine.
Music. So, where were you born and what was it like growing up there?
So I was born in Kingston, New York, which is upstate from New York City, and it was a good place to. I was born there, but then I grew up in Poughkeepsie, New York, which was, I think, a good place to grow up. I was raised by parents who moved to this country from Jamaica when they were in their 20s. And so even though I was growing up in New York, culturally, I was really surrounded and embraced in the West Indian or Jamaican culture, and so I think most of the formative life lessons growing up came more from my family, which was very, very close, and in some respects, it was also somewhat sheltered. So those were more of the important factors than really growing up in Poughkeepsie per se.
When you were a child, what kind of books or stories you enjoyed?
Well, I think I was always a dreamer. So my favorite author growing up was Judy Blume, and I read almost every one of her books. And I think that in part it was because of, just really being able to get into people's lives and as a child kind of imagine myself at their various ages and all of the different experiences that you have as an adolescent and as a teenager. And at the time that I was reading the books, I was younger than the characters, so it was always something that I could dream about being in those situations.
Well, I want to spend a little bit more time on your early timeline. If you give us a glimpse in the world of the 9-year-old Nicole, who she was as a young adult in college, and what were some of her thoughts after graduating as a physician?
Okay. Well, the 9-year-old Nicole, and I have to think back, at that point I knew that I was going to be a doctor. I didn't really know exactly what that meant because neither one of my parents are physicians, but it was something that I knew from when I was 4 years old. And it wasn't a question in my mind. It wasn't trying to figure out how I was going to accomplish it. I just knew. And so there was a certain level of, a certain level of confidence in knowing that I was good at things like academics, and I knew that that was part of ultimately becoming a physician, because I knew as much as I would ultimately have to go to college and medical school, and from that point on, again, that academics would was kind of integral to that.
Were you? Sorry. A young adult in college, and then some of your thoughts after you graduated.
Right. So a young adult in college, like I said, growing up in Poughkeepsie, I think that my general kind of summation was that we had such a wonderful family, but it was a bit sheltered. And so when I went to college, it was it was the whole wide world, in a way, coming from out of Poughkeepsie, New York. And I was surrounded by all of these really just wonderful, intellectually curious, nice people that a number of them actually I've still maintained close relationships, close friendships with. But I think coming out of that environment, it was a bit overwhelming in some ways, and so it was a big period of growth for me, not just the things that I learned in the classroom, but I think the person who I was when I first started in college and the person who I was when I graduated were two very, very different people. I really discovered who I was and what I really enjoyed, both in myself and other people. And it was So overall, it was actually a wonderful period of just general growth for me.
Mm. Um, most of the I know quite a few doctors, and most of them say to me that the journey through medical school is quite challenging, quite tough, and you have to be strong and persistent and determined and all these things. Are you tough on yourself, Nicole?
I'm sorry, say that one more time.
Are you tough on yourself?
I think so. I think I am less tough on myself now than I used to be. I think I used to be very tough on myself.
If you were to ask your closest friends or family that question, would you say that would you say or would they say that you were tough on yourself?
Would they say that I'm tough on myself?
Uh huh.
Um, I think so.
You think?
Uh-huh.
And what prompted you to want a career in internal medicine?
So I always thought that I would do something related to pediatrics because I loved kids.
Mm-hmm.
And when I did my pediatric rotation in medical school, I realized that sick kids were a whole different entity from, from happy kids who are just playing and being kids. And it was actually emotionally, I think it was harder than I had expected.
Uh-huh.
So in my pediatric rotation, it was just it was hard. I think as a physician, you have to. Even though you develop a relationship, a patient-doctor relationship, you still have to maintain a healthy distance emotionally to some extent. Otherwise, if a patient is very sick, or obviously, or if something bad happens, or if they pass away, it can be emotionally very hard. And I've experienced that certainly with even adult patients. But when I did my pediatric rotation, it was hard for me to really be that detached with the kids. And so then but still, I thought that, well, I may do maybe pediatric neurology or pediatric neurosurgery. I was just, thinking of different things. And in medical school, I think it was maybe the second year of medical school, we had these standardized patients. And I was, so with this, it was basically to help us to practice to interact with patients before we actually did our clinical rotations. And so after I met and practiced my interviewing and bedside manner with these standardized patients, the feedback that I got was very positive, but the overall consensus from these standardized patients was that I would be a wonderful primary care physician. And at that time, I was thinking, well, no, I don't want to just do primary care. I want to do something that's viewed as more, more challenging or just more prestigious or, whatnot. And these were just my own internal kind of, I think, conceptions at the time. But what I didn't realize is that what they saw in their interactions with me was exactly correct. And the interesting thing is that now doing internal medicine, I absolutely love it. And when I think about, well, could I do any of these other specialties? And I certainly could, but there's really no other specialty that I think would give me the fulfillment, the overall fulfillment and joy that internal medicine does. And now it's that relationship. I have such wonderful patients, and I really enjoy the continuity and care and the relationship that I have with my patients. And the impact that I can have.
You said your parents are immigrants from Jamaica, right?
Yes.
Have you spent a lot of time on vacation there as a child growing up?
Yes, as a child, we would go actually quite often, and at that time we had a number of relatives who lived in Jamaica, so we would as a child we traveled all over the island.
And your parents, do you recall any words of wisdom from either of them that shaped who you are today?
Well, yes. Both of my parents have always been extremely supportive and nurturing, and never made me feel as though I had to do something that they, that they felt was something that was necessary to succeed in life, but they were just supportive, really, with whatever it is that I wanted to do, whatever it was that I was passionate about. And I had a recent conversation actually with my mother with regards to when I was 4. She had given me a doctor kit, one of those toy doctor kits, and I I was thinking recently something that I hadn't thought about when I was younger, that I have a brother who's 1 year older than me, and why it was that she had given me the doctor kit. And she said that so she always had an interest, growing up in Jamaica, an interest in healthcare. And back then she just didn't see any male physicians. And so her intention when she gave me that toy doctor kit was that she wanted me to know at 4 that as a girl who would ultimately grow up to be a woman, that being a doctor was something that was entirely in the realm of possibility, and that it was that it wasn't that if medicine was something that I wanted to do. She never actually put that concept or idea in my head, but I think that what she had conveyed was that her thought was that I know at that young age that I'm not limited to what her experience. I wouldn't have to be a nurse. A nurse is a wonderful profession, but that as a female I could also be a doctor.
Do you think, in retrospect, that her giving you that kit and her reasons for it, do you think it has caused you to be more sensitive to young girls getting into medicine, or you sort of encouraging them to get into the field?
I'm sorry, Selwyn, say that one more time. Am I encouraging them to do what?
Right. Do you think that the way your mom related to you when you were 4 years old by giving you that kit, and her reason was she didn't see too many women in the field, do you think that has had an impact on you in the way you look at young girls who want to get into to the medical field, or does it encourage you, or has it caused you to encourage young girls to get into medical field?
Well, I think whatever profession any young girl would choose to go into, if it's something that she is passionate about, if it's something that fulfills her purpose, then that's the perfect field for her to go into. Whether it's medicine, whether it's nursing, whether it's practicing as a physician, whether it's nursing, whether it's teaching, whether it's computer science. I mean, whatever it is. So I think for me, the exposure to that toy doctor kit wasn't about me then becoming a doctor, as much as exposing me to something that potentially could trigger something within me, that kind of that innate passion or desire within me. So I think for young girls, it's just young, as well as young boys, I think it's more exposing them to all different kinds of things, so that they can then, so something is triggered within them, and they'll know what it is. It's not for somebody else to decide. But I've mentored and worked with children or young people who live in environments where they're just not exposed to certain things. So it's really bringing in awareness and placing things in somebody's within their realm of possibility.
I want to ask you a hypothetical, and is nothing frightening. It's a warm summer day, and you're in the mood to relax with a book, something special to drink, and listen to some music. What will you be reading? What will you be drinking? And what music will you be listening to?
So I think right now I would be reading maybe one of two books. Either, and I have them both sitting in my house to read. So one is Nelson Mandela's autobiography. I think that there's just so much. I mean, his life. There's so much to learn from and absorb, and I would really like to have a big block of time to sit down and read that. And the other book is a book called A Course on Miracles, which is basically, I think, a book that kind of helps, or it has a lot of information on the life's journey. I would be. Did you ask me what I would be drinking?
Yes. What would you be drinking?
I would be drinking either probably a South African Cabernet, and listening to maybe some jazz music.
Jazz.
Mm-hmm.
Okay. Okay. Another family question. If you were to eavesdrop your family telling a group of people stories about you, what do you believe, A, your sister will be saying about you, and B, your parents?
What would my sister say about me, and what would my parents say about me?
Yes.
I think that they all would say the same thing. I think. I think they would say that that I'm a passionate person. I feel very strongly about things, and I really I guess feel the emotions that are associated with the things that I do. That I think they would say I'm a kind and loving person, and I think they would also say that I like to talk.
Okay. How do you deal with a patient who questions your experience because you look so young?
So, I used to love when patients. Well, actually, no. Now, in retrospect, I would love for patients to ask me that again. They used to ask me that at one point in time, and then recently, actually, a couple of weeks ago, a patient of mine, she asked me for some advice for her cousin, who is a physician, and she's a young physician, and she said, you always are so well put together, and I was hoping that, she said, this was after her physical, she said, this is kind of on the side, I hope you don't mind me asking this, but she said, you're always so well put together, and I was hoping that maybe you could give me some advice that I could pass along to my cousin, because I think that, she may be, she feels that sometimes she may be losing some patients because she's, and I think it's just that, she's a very good physician and she's very nice, but she just dresses very young, and I think that they just think that she's so young, and so what could I say to her to, help her dress so that she looks more, I don't know, quote unquote age appropriate, I suppose, for a physician. And I said to my patient, I said, tell her she should actually be glad that patients ask that, because I remember the day when things changed, and it was a day when I had referred. So I always ask my patients after I've referred them to other physicians what their experience was, how did things go? And so this patient who had come back to me, and I was having that conversation with her, and she said, well, he was nice, but he just seemed really young. And I looked at her and I don't remember I actually said this to her, but I know I was thinking, I knew he was older than me. Yeah, that hasn't been a problem recently.
Can you tell us what challenge you overcame that you're most proud of?
It's a great question. I don't know if I have an equally great answer for it, but what I would say is that despite the fact that I always knew that I was going to be a physician, my internship year, was a combination of sleep deprivation, stress, feeling overwhelmed, and I was surrounded by all of these incredibly impressive other residents, and I just, I felt there were times when I felt very, very overwhelmed, and quite frankly, there were times when I thought to myself, I don't know, when I really think with my head how I'm going to get through this year, because I know I need to get through this year in order to then go on to finish residency and actually practice. But when I thought with my head how I was going to do that, I really, thinking back, I really remember feeling just so overwhelmed that I didn't know how that was possible. Yet I think I rested in the fact that I just always knew that that's what I was going to do, and there was never any possibility of that not happening. And so I suppose maybe the challenge was resting in that faith. I can.
Let's take a quick break.
Okay.
We are back with Dr. Nicole Singh. Nicole, what is the least helpful advice anyone has ever given you, let's say during medical school or during your career?
I can't think of any specific thing that was not helpful. I can't think of anything specifically.
Okay. You have a very warm and friendly and easy to get along personality. I mean, it's quite evident. From which of your parents do you believe you have these traits, or is it both of them?
I think both. I think that they're both very warm and friendly. I think there has always been very frequent communication, especially between my mother and myself. We to this day we talk very, very often. My parents retired to Florida. They live in Florida now, and the other day, actually, she made a comment that well, we've always done that. So even as a child, I remember. So she was working, and we could call anytime during the day, and actually oftentimes we would page her, and we didn't even think twice about doing that, just because we wanted to talk to her about her day. And so that I think that from the family closeness, she certainly has played a large role in that. And I think I'm also like my father in a lot of ways, where sometimes he can be very quiet, especially if it's just, sometimes if it's just us. He's not always necessarily very talkative, and I can be that way as well. But when when company is around, when others are around, he is very talkative and very engaging, and I think generally considered a very friendly person.
In the chat room, Kim asks, Did you ever want to do something else?
Do I ever want to do something else now?
No,
No.
did you ever want to do something else?
Did I?
Uh-huh.
No. I think, like I said earlier, I think I had considered I'd considered music to some extent, but I don't think that I don't think that it was ever a real consideration over medicine.
And Leslie asked, what will you tell a young girl who wants to get into medicine but is afraid of the hard work and blood?
I would say that we all have to set intentions. So it's kind of like a patient who comes in and tells me that they want to be healthy, but they don't exercise and they smoke and they make all of these choices that really don't fulfill that intention. And so I would tell a young girl that if she wants to pursue medicine, or she thinks she wants to pursue medicine, that she has to set that as her intention. And I think I think to reach any intention, then we have to realize, okay, it's a matter of making day-to-day choices, and that once you have that intention set, if you are making choices that are not in alignment with that, then it's not going to feel quite right. And I think even a child would be able to understand that.
You went to the University of Pennsylvania, right?
Mm-hmm.
And how would you say your experience there has prepared you for who you are today?
That's where that is where I really feel like I learned what true friendship was. And like I said earlier, a number of my friends from undergraduate, from college, I still am close with, and I think that when you look at the importance of when you look at actual longevity, and when you look at what goes into wellness, I mean there are these there's this concept called blue zones, and blue zones are areas throughout the world where people live the longest. So they're the largest number of people who live to age 100, for instance. And socialization is one of the entities that is part of these blue zones. And I think so. As I had mentioned before, growing up in Poughkeepsie, I was sheltered and had this wonderfully close family, but I think it was college when the kind of the outside socialization for me, the biggest growth occurred, which has greatly impacted, obviously, my life today.
And being in private practice, how long have you been in private practice?
For 14 years.
14 years. And what are some advantages and disadvantages of being a woman in private practice?
Well, so I would say my patient population consists probably of about 50% women, 50% men, or close to that. And I've often wondered why it seems like over the years, male colleagues are generally able to just stay on schedule with patients, and so whereas as women, oftentimes we may, and I'm speaking of physicians, we may be running behind, and it oftentimes occurs because we're just spending more, we're spending time with the patient, as much time as they need, and then we may be running a little behind for the next patient. And I always, I wondered that for a while. I wondered if it was because, we're seeing maybe sicker patients or more complex patients, but that didn't make sense. But I think what it is now, what I think what is involved with that is, I think women tend to be nurturing by nature, and we like to talk, and I think patients like that. So I know that my patients, they we will sit there, and when I'm seeing patients, I don't wear a watch, I don't have a clock in the exam room. And so we just, I give them as much time as they need, and we talk, and I think that, I almost wonder if sometimes patients, and particularly male patients, because why would a male patient choose to come see a female? Wouldn't he feel more comfortable with a male physician? But I think that they, quite frankly, know that women are going to be very nurturing, and they will listen, and not that men don't, but that that's just really kind of an innate part of our nature.
One of your principles or mantras, I would say, is success comes from the deliberate alignment of your intention with your purpose. What does that mean to you?
Mm-hmm. So my intention, before I realized what an intention was, or what that meant, was again, from age 4, I knew, I said, I thought I was going to, in my mind, I was going to be a physician. Never wavered, and ultimately that's what I became. So then, after residency, I decided that I was only going to look at practices in Washington, D.C., and I found a practice that was that was just it was a wonderful practice with physicians who were of a quality, and are of a quality that really, I think, inspired me as a young physician, and inspired the way that I practice now. Because when you come out of residency, you start practicing, and I suppose the way that you start practicing, you're developing these various skills and way of doing things, and bedside manner, etc. And so it was just a wonderful practice, I think, to join in that manner. And shortly after joining the practice, I became a partner, and it was it was something where it was great in name and theory, being this partner in this wonderful practice in downtown DC. But financially, it was not exactly, as a young physician building up a practice, and then being a part owner in that practice, and the responsibilities of obviously overhead, and you have to cover your overhead before you actually get a check to take home. And if things aren't necessarily going as optimally as they could, as sometimes happens in running a business, well, it was, needless to say, it was not a great situation in that regard. And so I decided that I was going to leave. And when I decided that I was going to leave, my intention was to join a practice with a similar reputation of really top quality physicians, but also a practice that was a really well-run business. And business was something that I never I never had any interest in running a business. I had no idea how to run a business. They don't, at the time that I went to medical school, at least in residency, they didn't teach business management or the business of a small medical practice. And so I set that as my intention, and that's exactly what I found. I ultimately, so I left the practice downtown and joined a practice about 20 miles outside of DC in Northern Virginia. And it was exactly what looking back now, it was exactly what I was looking for in terms of what I had put my focus and my intention on. An extremely well-run business and a wonderful, quality again of medicine being practiced. But then 3 years later, I decided that, I really missed that the camaraderie and that feeling, that kind of that again, I tend to be, I think maybe more because I tend to be passionate and emotional, and so I missed that that warm and fuzzy feeling, I suppose, of walking into the office that I used to feel downtown. Really enjoying where I was, and I decided that I didn't want to join that practice in Northern Virginia as a partner, even though it was a wonderful practice. I learned so much about running a business in those 3 years. And so, to make a long story a little shorter, I ended up coming right back to the practice downtown that I had left. And so that's the practice that I'm still with, and I absolutely love now and feel very confident in my role of as part business owner, and I so going back to the intention and purpose, I didn't know that 10, 15 years ago that part of maybe the purpose for me is not just practicing medicine, but it's also having the autonomy and having the ability to structure my practice in a way that I can truly have the greatest impact that I feel that I need to have. And I think, for me now, I recognize that only comes in actually having complete control over the way that I practice.
And having this autonomy, how has that impacted the way you approach wellness and healing?
Mm-hmm. So, wellness, wellness has actually become a large component, or the concept of wellness has become a large component of the way that I practice. And I truly do believe that wellness comes from the day-to-day choices that we make. And so I spend actually a great deal of time when I'm talking with patients, and I put a strong emphasis on prevention. So I encourage patients to come in for their annual physicals, or for some people they may not need it every year, but for, I'll say, regular comprehensive physicals. And we spend a great deal of time talking about wellness. That was not helpful. I can't think of anything specifically.
Okay. You have a very warm and friendly and easy to get along personality. I mean, it's quite evident. From which of your parents do you believe you have these traits, or is it both of them?
I think both. I think that they're both very warm and friendly. I think there has always been very frequent communication, especially between my mother and myself. We to this day we talk very, very often. My parents retired to Florida; they live in Florida now, and the other day, actually, she made a comment that well, we've always done that. So even as a child, I remember. So she was working, and we could call anytime during the day, and actually oftentimes we would page her, and we didn't even think twice about doing that, just because we wanted to talk to her about her day. And so that I think that from the family closeness, she certainly has played a large role in that. And I think I'm also like my father in a lot of ways, where sometimes he can be very quiet, especially if it's just, sometimes if it's just us, he's not always necessarily very talkative, and I can be that way as well. But when, when company is around, when others are around, he is very talkative and very engaging, and I think generally considered a very friendly person.
In the chat room, Kim asks, did you ever want to do something else?
Do I ever want to do something else now?
No. Did you ever want to do something else?
Did I? No. I think, like I said earlier, I think I had considered music to some extent, but I don't think that I don't think that it was ever a real consideration over medicine.
And Leslie asked, what will you tell a young girl who wants to get into medicine but is afraid of the hard work and blood?
I would say that we all have to set intentions. So it's kind of like a patient who comes in and tells me that they want to be healthy, but they don't exercise and they smoke and they make all of these choices that really don't fulfill that intention. And so I would tell a young girl that if she wants to pursue medicine, or if she thinks she wants to pursue medicine, that she has to set that as her intention. And I think to reach any intention, then we have to realize, okay, it's a matter of making day-to-day choices, and that once you have that intention set, if you are making choices that are not in alignment with that, then it's not going to feel quite right. And I think even a child would be able to understand that.
You went to the University of Pennsylvania, right?
Mm-hmm.
And how would you say your experience there has prepared you for who you are today?
That's where that is where I really feel like I learned what true friendship was. And like I said earlier, a number of my friends from undergraduate, from college, I still am close with, and I think that when you look at the importance of when you look at actual longevity, and when you look at what goes into wellness, I mean there are these there's this concept called blue zones, and blue zones are areas throughout the world where people live the longest. So they're the largest number of people who live to age 100, for instance. And socialization is one of the entities that is part of these blue zones. And I think so. as I had mentioned before, growing up in Poughkeepsie, I was sheltered and had this wonderfully close family, but I think it was college when the kind of the outside socialization for me, the biggest growth occurred, which has greatly impacted, obviously, my life today.
And being in private practice, how long have you been in private practice?
For 14 years.
14 years. And what are some advantages and disadvantages of being a woman in private practice?
Well, so I would say my patient population consists probably of about 50% women, 50% men, or close to that. And I've often wondered why it seems like over the years, male colleagues are generally able to just stay on schedule with patients, and so whereas as women, oftentimes we may, and I'm speaking of physicians, we may be running behind, and it oftentimes occurs because we're just spending more, we're spending time with the patient, as much time as they need, and then we may be running a little behind for the next patient. And I always, I wondered that for a while. I wondered if it was because, we're seeing maybe sicker patients or more complex patients, but that didn't make sense. But I think what it is now, what I think what is involved with that is I think women tend to be nurturing by nature, and we like to talk, and I think patients like that. So I know that my patients, they we will sit there, and when I'm seeing patients, I don't wear a watch, I don't have a clock in the exam room. And so we just, I give them as much time as they need, and we talk, and I think that, I almost wonder if sometimes patients, and particularly male patients, because why would a male patient choose to come see a female? Wouldn't he feel more comfortable with a male physician? But I think that they, quite frankly, know that women are going to be very nurturing, and they will listen, and not that men don't, but that that's just really kind of an innate part of our nature.
One of your principles or mantras, I would say, is success comes from the deliberate alignment of your intention with your purpose. What does that mean to you?
Mm-hmm. So my intention, before I realized what an intention was, or what that meant, was again from age 4. I knew, I said, I thought I was going to, in my mind, I was going to be a physician. Never wavered, and ultimately that's what I became. So then, after residency, I decided that I was only going to look at practices in Washington, D.C., and I found a practice that was that was just it was a wonderful practice with physicians who were of a quality, and are of a quality that really, I think, inspired me as a young physician, and inspired the way that I practice now. Because when you come out of residency, you start practicing, and I suppose the way that you start practicing, you're developing these various skills and way of doing things, and bedside manner, etc. And so it was just a wonderful practice, I think, to join in that manner. And shortly after joining the practice, I became a partner, and it was it was something where it was great in name and theory, being this partner in this wonderful practice in downtown DC. but financially it was not exactly, as a young physician building up a practice and then being a part owner in that practice and the responsibilities of obviously overhead, and you have to cover your overhead before you actually get a check to take home. And if things aren't necessarily going, as optimally as they could, as sometimes happens in running a business, well, it was needless to say, it was not a great situation in that regard. And so I decided that I was going to leave. And when I decided that I was going to leave, my intention was to join a practice with a similar reputation of really top quality physicians, but also a practice that was a really well-run business. And business was something that I never, I never had any interest in running a business. I had no idea how to run a business. They don't, at the time that I went to medical school, at least in residency, they didn't teach business management or the business of a small medical practice. And so I set that as my intention, and that's exactly what I found. I ultimately, I left the practice downtown and joined a practice about 20 miles outside of DC in Northern Virginia. And it was exactly what looking back now, it was exactly what I was looking for in terms of what I had put my focus and my intention on. An extremely well-run business and a wonderful, quality again of medicine being practiced. But then 3 years later, I decided that, well, I really missed that the camaraderie and that feeling, that kind of that again, I tend to be, I think, maybe more because I tend to be passionate and emotional, and so I missed that warm and fuzzy feeling, I suppose, of walking into the office that I used to feel downtown. Really enjoying where I was, and I decided that I didn't want to join that practice in Northern Virginia as a partner, even though it was a wonderful practice. It was I learned so much about running a business in those 3 years, and so to make a long story a little shorter, I ended up coming right back to the practice downtown that I had left. And so that's the practice that I'm still with, and I absolutely love now and feel very confident in my role of as part business owner, and I so going back to the intention and purpose, I didn't know that 10, 15 years ago that part of maybe the purpose for me is not just practicing medicine, but it's also having the autonomy and having the ability to structure my practice in a way that I can truly have the greatest impact that I feel that I need to have. And I think, for me now, I recognize that only comes in actually having complete control over the way that I practice.
And having this autonomy, how has that impacted the way you approach wellness and healing?
Mm-hmm. So, wellness, wellness has actually become a large component, or the concept of wellness has become a large component of the way that I practice. And I truly do believe that wellness comes from the day-to-day choices that we make. And so So I spend actually a great deal of time when I'm talking with patients, and I put a strong emphasis on prevention. So I encourage patients to come in for their annual physicals, or for some people they may not need it every year, but for, I'll say, regular comprehensive physicals. And we spend a great deal of time talking about wellness and those and prevention, and the effect that their day-to-day choices have on their health, in health being not just physical health, but it all, what I recognize now that is that, it's all intertwined. So physical health, mental health, emotional health, spiritual health. And having the autonomy it really allows me to structure my schedule in a way that I'm not having to only spend 15 minutes with a patient. So I structured in a way where with a physical, I spend an entire hour. And, again, because I don't have any type of time device, I don't have a watch or clock in the exam room, I really give everybody as much time as they need. And we talk about the importance of prevention and all of the things that are entailed within that. We talk about wellness. And as a result, I see patients, really patients that I've had a relationship for years, just becoming healthier and healthier. And I like actually pointing out to them, because I'll compare, the various complaints that they had from the previous years with how they're feeling now. And we actually, and oftentimes I find myself saying, you're doing so much better than last year or 2 years ago. And I think, that's positive reinforcement, certainly for both of us, for both myself and the patient.
Do you find when you meet your patients for the first time that their idea of wellness is aligned with yours? Or do you have to do some orientation or some education in the beginning?
Yeah. It depends. I mean, I have a number of patients who are very interested in taking care of themselves with regards to exercising and eating healthy and not smoking. But patients, patients don't necessarily know the reasons behind all of the different preventive advice or screening studies that we recommend. So I think that I think that the concept is certainly oftentimes there, but then the content, I think that they, a lot of it is understanding, well, why is it that, I need to have a colonoscopy, or why is it that, maintaining a bold blood pressure is important. And I think that in having those conversations, it's more effective for me as a physician to then have the outcome of them actually, when they leave the office, and that office visit being one day, and then all the other 364 days actually making the choices that are really important for them.
What are some wellness questions you believe need to be asked that many of us, especially young people, are not bothering to ask?
Right. Okay. So so a large part of wellness is prevention, and so at a general comprehensive physical visit, for instance, just quickly, the things that we would discuss would be obviously their personal medical history, the medications they're on, their allergies. screening. And screening tools are age appropriate. So the purpose of screening, of doing a screening study, is something that is a study basically that's going to reduce mortality by doing that study. So reduce the risk of a person dying from that particular condition, and that reduction outweighs the potential risk of that type of study. So, for instance, in a young person, there are screening studies would involve things like pap smears, and we do pap smears because of the risk of developing cervical cancer, which we now know is associated with the human papillomavirus. And we do pap smears starting at age 21. And the guidelines for that changed a couple of years ago, basically by extending the interval. So now between 21 and 30, it can be up to every 3 years. Some women choose to still have it at shorter intervals. And then from age 30 to 65, it's every 3 years, or if co-testing is done with the HPV testing, then every 5 years. And so one conversation regarding that particular study would be that cervical cancer for a lot of young people, like women who are in their 20s, they know that they have to get a pap smear, but they don't necessarily understand why. And they don't even realize that there was a point in time when women were dying from cervical cancer. We don't hear from it now. We don't hear about that now because of the advent of obviously of healthcare prevention, doing these pap smears. But many women died from cervical cancer because pap smears were not a part of routine medical care. So that's in a young person, and then we start getting into in terms of cancer prevention. There's colonoscopies, and colonoscopies are very, very important because what they're looking for are polyps, and so polyps are little growths in the intestine, in the large intestine, that are generally benign. There are two common types. There are what are called hyperplastic and adenomatous polyps. But those adenomatous polyps, which if a person has those polyps, they don't have any symptoms at all, but it can take at least 10 years. We think that it takes about at least 10 years for that polyp to develop into a colorectal cancer. And doing a colonoscopy as a screening tool versus waiting until a person is having symptoms, they're able to remove those polyps and thus significantly impact on the incidence and the mortality of colorectal cancer. And that's a screening test that that for the average risk person, we recommend starting at age 50. And then, of course, there are mammograms and PSA testing. And these are all the screening tests that I discussed regarding cancer screening. Mammograms and PSA testing are prostate-specific antigen testing, which is for prostate cancer. And then there's more controversy regarding those screening tools, yet we are still certainly recommending mammograms, and mammograms starting at the age of 40 or every 1 to 2 years, and then 50 certainly every year. And then PSA testing, there's been more controversy, a lot of recent controversy, and so really the approach that we take now as physicians is having a more in-depth conversation about the pros and cons of doing prostate screening with the PSA test. And so all of these conversations though take time, but with taking the time to have these conversations, I think that the patient feels more, they feel more enabled to make the decisions that they feel are important for their health, rather than kind of the old old-fashioned way of practicing, paternalistic medicine, where I, as a physician, just say, you do this, and and don't ask me why. I mean, now it's a lot more, for me at least, it's a lot of conversation regarding why we're doing these tests, and I think that it really helps with patient compliance.
I was asked to ask this question. What is a prevailing wellness issue in poor communities?
In poor communities? Is that the question?
Yes, that's a question. In poor communities.
Well, in poor communities, I think that unfortunately there is a lot of probably hypertension or high blood pressure and diabetes and obesity, and there are a lot of factors that are involved with that. I think unfortunately in poor communities, you're not going to have, a farmer's market right on the corner, or a Whole Foods. And even if there were a Whole Foods, the prices, can be somewhat high in the Whole Foods, or are actually quite high in the Whole Foods. And you'd be more likely to find, Popeyes and things like that. And so the diet, which plays a huge role in wellness, becomes a big factor, because even if we talk about vitamins alone, I mean, vitamins are something that with the exception of vitamin D, our body is not able to actually produce on its own. It's not able to synthesize. It's just the only one is vitamin D, and so it really speaks to the importance of diet in providing all of these really important vitamins and minerals that have a big impact on health and wellness. And we know that there's an effect of vitamins that appears to be more via food, because there are all of these observational studies that have shown mortality benefits and benefits with regard to a whole host of health issues that are related to vitamins when we looked at observational studies. But then when there were control studies that were done with vitamins that we ingest, such as multivitamins, or and so ingest in tablet form versus in the food, that we didn't see those same vitamins. And that's actually why, we didn't see, that same benefit. So that's actually why there was recently a lot of information in the media with regard to, well, there is no real benefit. There's actually no proven benefit to taking a multivitamin, for instance. And so it becomes so much more important with regard to getting proper nutrition through our diet. Then there's exercise. Exercise, we know that has an impact on wellness, and obviously it has an impact on blood pressure. Blood pressure being one of the major contributors to cardiovascular disease. Atherosclerotic cardiovascular disease being the leading cause of death in this country. So then you go back to the exercise, and if there's no place, there are no parks or places or the gym membership is too expensive, or not. If exercise is not a regular part of a person's lifestyle, then that's going to have an impact on their wellness. And then you combine those, poor diet and lack of exercise, and you introduce obesity, and of course that's that is involved with a whole host of chronic health problems, diabetes, again, atherosclerotic cardiovascular disease, various cancers, and so I think at that level it's really starting with the basic lifestyle. How do we improve the lifestyle choices that people in impoverished areas are able to make?
Talking about that, When eating out, what are some guidelines you use in selecting a healthy option?
So, in general, I mean, for the average person, a well balanced diet is going to be one with, so obviously you need protein. And so it's not, if a person chooses to eat meat or not, that's not so important. But fish can be important in that it provides your omega-3 fatty acids. And having the omega-3 fatty acids via certain fish like wild salmon and tuna and mackerel, that there's cardiovascular benefit there. It's important to incorporate whole grains and nuts and legumes and obviously fruits and vegetables. And so I think some combination of making sure that all of those ingredients are part of a well-balanced, healthy diet is important.
Talking about hypertension and diabetes, and I'm thinking about fibroids mostly in black women or so, or at least that's what some studies say. What do you think is the biggest healthcare challenge facing black men and women today, or one of them?
Mm-hmm. I think one of them is hypertension, is high blood pressure, because, like I'd mentioned earlier, atherosclerotic cardiovascular disease is the leading cause of death in this country, and there are three major factors that we can have an impact on that. There are obviously more than just three, but hypertension is one of the things that we can affect change with, and it's probably one of the, if not the most common, and certainly one of the most common risk factors. I think it actually may be the most common risk factor that influences atherosclerotic cardiovascular disease, and it's asymptomatic. So people don't have any symptoms when they have high blood pressure, and there are obviously important roles in terms of smoking cessation and obesity and diabetes, but I think that we would probably affect the most people by targeting hypertension compared to those other conditions.
Let me just go to the chat room for a second. Leslie asks, who were some of your mentors, if you had any?
So when I was in college, there was a gentleman, Dr. Johnson. He was a PhD who was on faculty, on research faculty, I guess, at University of Pennsylvania. And I started working in his lab. So in the summers, I would work in his lab, and he was a natural mentor, I think. And I remember how in the summers when I would meet him very early, and there was a week I think at least one summer when my sister, who is younger than me, and she came to visit, and so she would join us, and we would go for breakfast in the morning. And he would always have 3 newspapers with him, and he said every morning it's just very important to keep up with the news and to read to read the news, and so we would all have to sit there and pick something out of the newspaper and read. But he was a wonderful mentor.
And Free Girl said, what skills and personal traits make for a good internist?
I think you really have to care about other people's wellness. Because I think that, as an internist, so people view you as their doctor. So they have other doctors, but when they think of their doctor, it's you are kind of that frontline person for them. So I have a number of patients, actually quite a few, who will, they'll see specialists and they'll call me or come back and they want to know what my opinion is with regard to whatever piece of advice they received. And I think that it's important for them to know and sense that you genuinely care about their wellness, and I think that so that then contributes to having just a good relationship, because that's what it is. It's a patient-doctor relationship, but also being able to actually have the positive impact that you really need to have in that role.
I'm going to ask you one question and then we go for a break. Uh, with all your accomplishments, what keeps you grounded?
Um, you know, I don't view being a doctor as any more important than any other profession out there. And I think that whatever profession a person chooses, as long as it's something that they that they enjoy, that they feel that they are um, having a positive impact with, and I think that people like to feel that they're doing a good job just in general, and so in a position where they get that gratification, whether it's externally and or internally, and so I think that I'm grounded in knowing that that I'm doing what I do and I'm living my life in a way that I am just being true to to who I am.
We'll take a quick break, but while we're on the break, I would like you to think about this question. What are some guidelines we can use to guard against diabetes and hypertension? We are back with Dr. Singh. Nicole, the question I asked before was what are some guidelines you can give us to guard against hypertension and diabetes?
Okay, well, first I will speak on um, the importance of, again, prevention in terms of you have to, with regard to hypertension, you have to know what your blood pressure is. And so going into the doctor not just when you're sick is very important. And actually, the recommendation now with regard to blood pressure screening is for a person whose blood pressure is no more than 120 over 80, they can have it checked every 2 years. And for someone whose blood pressure is higher than 120 over 80, and then hypertension is actually defined as blood pressure greater than 140 over 90. But not just on one occasion, because oftentimes the first time a person goes into the office, their blood pressure may be elevated. It's it's a new doctor, a new place, and there's a little anxiety that may be associated with the whole experience. And so by definition, to be diagnosed with hypertension, a person would have to have an elevated blood pressure. So again, over 140 over 90. on at least 2 additional occasions in the office after the initial visit. So that would be at least 3 visits, and not just one day after the next. It would have to be over a period of maybe weeks. And what they found, or what we found, I suppose, is that sometimes over time the blood pressure, it's not hypertension, it was just that they had an isolated elevated blood pressure, or 2 isolated elevated blood pressure readings. And so that's hypertension. And then diabetes is a condition, and there are actually 2 different types of 2 different common types of diabetes, I suppose. There's type 1 and type 2. And so we'll talk about type 2 because that's really the one that in general I think people are talking about with regard to prevention. And that's where the pancreas is able to produce insulin, but there's a resistance issue, the body's resistance to that insulin that's being produced. And so by definition, with regard to diabetes, it's a fasting blood sugar over 126. We also check a test called the hemoglobin A1C, which is a more long-term measurement. But there is a condition called pre-diabetes, which is when a person's blood sugar is higher than 100. So now the upper limit of normal is 100. When it falls between that 100 and 126 range, it's considered pre-diabetes or impaired glucose tolerance or insulin resistance. And the general thinking now is that if a person does not make significant changes, then there's about a 50% chance that a person may go on to develop full-blown diabetes. So again, prevention then becomes very important before a person develops diabetes, and especially when they first reach that pre-diabetic phase. And so the things that are very important in terms of preventing the progression to that hypertension or preventing the progression to the full-blown diabetes would be some of the things that I discussed earlier. So we know, studies have shown that aggressive diet, exercise, and weight loss or weight control has as much of an impact as medications in preventing diabetes, so even in the pre-diabetics. And that if somebody has an elevated, what we call BMI or body mass index, so a normal BMI is somebody with under 25. So a BMI under 25 is considered normal weight. Then between 25 and 30 is overweight, and over 30 is obese. And so obesity in particular is a major risk factor for both diabetes and hypertension. Reducing the weight, so changing the diet and increasing exercise, because a sedentary lifestyle is going to be a risk factor. But not just walking from here to McDonald's, but actually getting what's considered at least moderate exercise, which would be a minimum of 30 minutes 5 days a week, which is obviously not a huge amount, but that would be considered at least a moderate level of exercise. That and the diet and weight reduction, so going from the obese category down to at least overweight, or overweight down to the normal weight category, that has a significant impact in terms of reducing the development of diabetes. And then those things actually play a role in terms of hypertension or developing hypertension as well. We know that obesity is a risk factor for hypertension. We know that the exercise regular exercise, even regular moderate exercise, helps to reduce blood pressure readings. And then, there are things outside of that, like sleep. I mean, the importance of regular sleep, because sleep deprivation can affect blood pressure. I mean, people with obstructive sleep apnea, where it's an impaired sleep condition, that's actually in itself a cause of elevated blood pressure, high blood pressure, like a secondary cause. And then stress. And stress management is very, very important because stress can affect blood pressure, especially chronic stress. And stress also can affect cortisol levels in the blood and has elevated blood sugars and contribute to so the elevated blood sugar or diabetes.
Dion asks, can young women have pap smears prior to age 21?
So we used to do pap smears prior to age 21, but what was happening was that unfortunately, a lot of women in their late teens, when they would get pap smears and they would come back abnormal, and then they would have to go on to get follow-up studies such as colposcopies and even more invasive studies and so or procedures. And so what they found was that in women younger than 21, an abnormal pap smear is more likely to, over time, normalize. And so the other component of the screening test is I suppose, part of the oath that we took, do no harm. So you don't want to do sometimes over testing can be more than just a benign thing, but can be potentially harmful in that doing pap smears before the age of 21 may then cause women to have more procedures or procedures, I should say, that they would not otherwise need to have, because in waiting until they turn 21, then whatever cellular changes there may have been, and whether it was contributed by inflammation, those changes by just waiting would no longer be there, and it would return as a normal pap smear.
And Dion asked again, how can someone who was diagnosed with prediabetes prevent it from becoming full blown?
Well, so I think I talked a lot about the importance of diet, exercise, and weight control, weight reduction. So those lifestyle changes. And then there are some studies that also have shown a benefit with medication. So in some patients with prediabetes, we may actually put them on an oral diabetes medication as well. But the first emphasis really needs to be on those lifestyle changes, and that has been proven to be beneficial in preventing the progression towards diabetes.
Okay, is there anything you wish you would have known before becoming a physician?
I wish I had known what running a business entails, maybe a little sooner.
And looking back on your medical career, are there any regrets?
No, I think I think that as a result of that journey that I mentioned earlier, what I found is that things have just gotten better and better.
What is the most humbling lesson you learned as a physician?
I think the realization that there are certain things that are just completely out of our hands. I've had patients with, fortunately, very, very few with very bad diagnoses, pancreatic cancer, ALS, and it is. I think that the first time that you have a patient who passes away, I think it took me by surprise how upsetting it was.
Hmm. What is a typical day like for Dr. Singh?
So I probably spend about 50% of the clinical hours doing doing physicals, comprehensive physicals, and then the other 50% is divided between follow up of various chronic conditions or chronic illnesses. So obviously hypertension, diabetes, hyperlipidemia, or high cholesterol. And sick visits. So patients coming in, upper respiratory infections, sore throats, and cough, and back pain, and etc. Oh, and then after all of that part, which I very much enjoy, there's the part of medicine that I don't enjoy quite as much, and that's the paperwork.
What are the most important things that women can do to protect their reproductive health?
So the screening tests are very important, and I spoke quite a bit about pap smears. There is an HPV vaccine, a human papillomavirus vaccine, that's available for girls, and I believe that the upper age. I don't actually offer that vaccine. I think that the pediatricians and gynecologists would be more likely where they would get it. A lot of my patients, because I just practice adult medicine, by the time that they come to me, mostly the ones in their late 20s or 30s have already received it. But I believe the upper age is still 26 in terms of when it's approved so human papillomavirus is a virus that is viewed as a sexually transmitted virus that is very, very prevalent. And there are various strains of that virus. So there are strains that can cause genital warts, and then there are strains that can cause cervical cancer. And there are certain strains, the very high oncogenic risk strains, so the high cancer-causing risk strains, and two of those are the strains 16 and 18. And so by getting the HPV vaccine, which covers those very high oncogenic risk or cancer-causing strains, it covers those strains. That's one very good preventive measure that can be done, and that is, that's a relatively new method that's being offered. Obviously, in terms of preventing reproductive health, for young women, it's very important to use condoms and to use protection, because things like chlamydia and gonorrhea, they are factors that can affect fertility down the road. And unfortunately, sometimes, women, if they are not having any symptoms, which a number of them may not have any symptoms, then they may not know that they have an infection, and that infection can then go untreated and affect fertility. It is now recommended to actually screen for those in very young women as well, so in women in their 20s. So oftentimes when a woman in her 20s gets her pap smear, she will be screened for those as well.
I always marvel at how time creeps up on us in the show, and we're almost at a close. But I have a few more questions for you. See how fast I can ask you these. Do you have a favorite type of music, and what will that be?
I like a lot of different types of music. I think my favorite types are things that kind of bring me back to different periods in my life. So, if I really, so like I mentioned earlier, I do like jazz, and I enjoy, for instance, Dave Brubeck's Take 5 in particular, because it brings me back to my childhood, because my father used to play that a lot. And I like reggae for obvious reasons. I love Bob Marley. And I enjoy classical music, although I probably don't sit down and listen to it as much. But because I was classically trained when I played the flute, I have an appreciation for that as well.
What are you most proud of?
I'm most proud of feeling like I have reached a point in my life where I've actually figured out some of the important things in life.
If you could go back in time, what would you tell the 13-year-old Nicole?
I would say to remember that, or to know that life is a journey, and that all of the lessons and the challenges are there for reasons, and don't get caught up in them, but be still for a moment and learn from them, and that will bring you to the next stage and a better stage.
What do you look forward to doing on weekends?
On the weekends? Rest.
Rest. Finish the sentence. The best part of Sunday evenings is?
The best part of Sunday evening is knowing that I'm at a place in my life where I can do the things that I enjoy. I can spend time with family. I'm fortunate to have my sister who lives very close to me, with friends. I have wonderful friends, and to know that the following day will involve going to work that I enjoy.
And there are two in the chat room. Kim asked, any wellness success stories?
Yes. You said any wellness thoughts or stories?
Wellness success story.
Oh, wellness success story.
Mm-hmm.
Yes. Yes, definitely. So there was this is a patient who actually I even told him. I think I told him last year that he is I asked him if it was okay if he'd be the poster child for my my emphasis on the importance of getting regular physicals and checkups, and he agreed very graciously. And he's a gentleman who when he was about 57, I think. So he was always very compliant with coming in for his annual physical. Every year he would come in for his annual physical. He felt great. He felt perfectly well, no complaints. And that year, so it was, and I want to say 3 years, but the way that time flies, it could have been 4 years, I'm not sure. When I got his labs back, all of his cell counts, meaning his white blood cells and his red blood cells and his platelets, were all very, very low. He felt perfectly fine. He didn't feel tired. He just felt well. And so I thought that, well, maybe it was just a lab mix-up or something. And so I quickly had him come back, and I rechecked it, and they came back in the same range. And so I subsequently sent him to a hematologist oncologist. He was diagnosed with a condition called myelodysplastic syndrome, which then very rapidly turned into a very bad form of leukemia. And he ultimately was treated. He received a couple of bone marrow transplants from, actually, I think, one of his daughters, and he had a very, very, very rocky course in terms of being treated for this condition. And 2 or 3 years later, I got a report from the oncologist at Hopkins who was treating him, and I've never seen this in any consultant report. It said at the bottom, and under the assessment, it said, "It's miraculous. He is in complete remission."
Wow.
And he's doing great. He survived. He's doing great. And I asked him. So last year, I asked him. I said, because I would see him periodically during the illness, and he had a very, 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 very rocky course. I mean, he, the bone marrow transplants, then he had, I think he had graft versus host disease. I mean, he was just sick, really, really sick. But when I would see him periodically, I didn't see him that often during the treatment of the cancer, because obviously he was in the hospital for a lot of the time. He was seeing the oncologist and other specialists. But when I would see him, he never complained. I've never once ever seen him or heard him complain. And so I asked him one day last year, I said, this is just amazing. I mean, I said, I've never seen anybody write this in a report. And I said, you've never complained. How were you able to do that? How were you able to always stay so positive? And he told me, he said, and I wouldn't have known this if I hadn't actually asked him this, but he said he always knew, regardless of how bad, how sick he was, he always knew he was going to survive this. Because apparently, when he was a teenager, there was I don't know if it was a friend or an acquaintance, and this other teenager, a girl, she had looked at him and she said, you're going to be in a very bad accident, but you're going to survive that. And then you're going to have a very bad illness, and you're going to survive that, and you're going to live a long life. And he told me that one day, this was years before the cancer diagnosis, he was walking to work in Georgetown, and a car hit him. And he was in bad shape. He went to the emergency room, and the doctor said, you should not have survived this accident. And he survived. And so so when he was going through the cancer diagnosis, he said he always knew he was going to survive. And I think that it speaks on, again, intention. And so whether we're talking about what we do or whether we're talking about our health, there's a role in all aspects of our life.
I love that. Before I ask you the last question, I want to go to the chat room again. Rick asked, what distinguishes your approach to medicine?
I think my practice of medicine has evolved, and it's become much more wellness based than it used to be. I think it's easier to spend the time because, again, it does require a lot of time to have these conversations. And when a person comes in and they have multiple complaints, it's hard then. You just don't have any time to really spend on what are you doing for stress management and, really delve into the reasonings behind why I'm recommending, why we as physicians are making all of these specific recommendations. And so I think what distinguishes me now is that I found that I'm not stomping out fires. I'm not, I see patients coming in over time, and they're healthier, and we have more time to really focus on all aspects of wellness. And going back to something that I said earlier, so not just physical health, but really the role of mental and emotional health, and all of the how all of that is intertwined.
And the last question I ask every guest that comes on the show: what makes you laugh out loud?
So I think the things that make me laugh the hardest are silly experiences or stories from the past when I'm talking with very close friends or family. I'll just give you one example. A good friend of mine from college, so this was now over 20 years ago. We were in college, and it was a person that I was dating, and it was a minute relationship. I mean, it was very brief, but it was at the time, it was just so traumatic, and I just It was just such a terrible, traumatic experience. I broke down crying so much that I developed a subconjunctival hemorrhage, and my eyes were bloodshot red. And she looked at me and she said she said I looked so scary. And well, 20 years later, having that conversation, we both really kind of just burst out laughing, because now being able to recognize how silly that was, but also recognizing that, here's this person who was there for me in my life back then and is still in my life now, and and is able to kind of share those old silly experiences and those sorts of things.
Well, I want to say thank you so very much for spending this time with us and being so candid and so eloquent. And now that you are an official woman of CWS, I am going to invite you to come back sometime and share with us some more health matters. But thank you so very much for your time.
Well, thank you for having me, Simon.
Oh, you're welcome. Quite welcome. So good night.